Welcome back to TV5 News at 9. Today we are talking about concussions with board-certified neurosurgeon Dr. J. Jaganathan. Thank you so much for joining us today, Dr. J.
Morning, Colette. Thanks for having me.
Good morning, of course. Okay, first tell us, Dr. J, what concussions are.
So a concussion is usually a transient change in the brain's function. Usually it's caused by traumatic forces. Commonly you hear about it after car accidents and things like that. But more and more we're hearing about it after sports as well. And traditionally it's been defined as a mild traumatic brain injury, but our current information and research shows that it may have more lasting effects than we originally thought.
Well, now, you know what, doctor? How has the way that you approach concussions, how has that changed?
So only about 10% of concussions involve loss of consciousness. So one of the things that classically people have thought about is that if you were knocked out or you had loss of consciousness, that would be a concussion. But we know now that it could be more minor trauma to the brain that can have the same effects of concussions without the loss of consciousness. The other thing that we know now is that CT and MRI scans can often be normal after concussions. So usually the clinical judgment, meaning what a patient is telling you, is as important as any type of diagnostic studies. And in spite of these factors, though, up to 15% of patients may have symptoms lasting longer than a year. So it is important that patients who have these symptoms, especially after sports, be identified and that they be treated appropriately, because the sequelae or the results of these oftentimes can be long-lasting.
Also joining us this morning, former NHL player and Stanley Cup champion, Steve Oleksiak. Thank you so much for joining us. We appreciate it.
Thank you for having me.
Of course, Stephen. Now, as a former professional hockey player, can you tell us a little bit about your experience with concussion, Stephen?
Yeah, I've been on the receiving end of a couple, but early on in my career, we weren't really educated on that topic, and the only one on staff that knew about that was our trainer. Our coaches weren't educated, players weren't educated. So early on in my career, it was just known as having your bell rung. And as we became more aware and more educated, the understanding grew of it's not always the big hit. The little ones have the same impact on the head and the brain.
Now, have you really seen a change in how concussions were managed since you played?
Early on in my career, they were often looked at as weakness, or you were encouraged not to report symptoms. A guy like myself, who was an up and down guy, you never wanted to lose an opportunity due to a concussion. And then as time changed and our knowledge of concussions and the impact of concussions changed, they were taken a lot more seriously. And we had there's actual spotters in the stands now that might see your reaction to a hit or symptoms, and you're pulled directly off the ice and evaluated off the ice, which was not the case early on in my career. And they're taken a lot more serious, and you aren't allowed to return to play until you're completely 100% symptom-free, which was not the case early on in my career.
Wow. Okay, so now as a coach, how do you handle players with concussions?
There's a much greater understanding of what they're going through and the long-term effects of concussions. You see guys that go through that and how they are later on in life, and the effects of the repeated blows to the head, and they understand that they are experiencing these symptoms. They're going to get back as soon as they feel healthy, but everybody responds to that impact differently, and some guys take longer than others.
Now, is there something that specific that you kind of look out for even after a player is cleared to play again?
You go through a number of tests, and they have a number of baseline tests that we take early on in the season. And then once you experience those symptoms coming back, you have to completely pass the baseline exam. And then, you're put through a series of physical activities. If you experience any headaches at all or any symptoms, you have to start back at square one.
Well, Stephen, thank you so much for joining us today and giving us your personal experience with concussions. That really was very helpful. We do appreciate it. Thank you so much for joining us.
Thank you for having me.
Of course. Well, Dr. J, how can we minimize the risk factors for concussions?
A topic like this really involves cooperation, not only on the medical side, but on the coaching side and from the player as well. I think it starts with teaching safe techniques, for example, in hockey or football, things like tackling, checking, things like that, to be taught in a safe manner. Wearing appropriate protective equipment, helmets, things like that are critical. And then unlike, in the past, players were often discouraged from reporting symptoms, and now it's generally recommended that players be encouraged to report symptoms without any type of fear of punitive action or being benched or anything like that. And it's also important to recognize that these injuries are more common in young athletes. I mean, we typically see this in young patients, and that's important because the downstream effects, the effects later on, can affect these patients for the rest of their lives. And finally, patients that have suffered concussions, they do need physical and cognitive or brain rest. As Steve pointed out, patients shouldn't be rushed back to play until they're fully symptom-free. And the reason for that is because we know that down the road, these concussions can have a severe effect on people if they're allowed to continue without being stopped.
Dr. J, do you have any last advice or information you'd like to give young athletes out there listening?
I think the key is to identify the symptoms, as we discussed. These can vary from person to person, to recognize that sometimes even when the medical studies, the imaging is normal, it can represent a concussion, and to seek medical attention and to let your coach and team know if you start having those types of symptoms.
Perfect. Thank you, Dr. J, once again for joining us today. We appreciate it so much.
Thank you very much.
You are welcome. And if you'd like any more information about this topic, head on over to the hot link section of WNEM.com.